Ghana Education Service go to our schools to go and deworm our school children. And one of the main reasons why they go there is because of a disease called Schistosomiasis, popularly known as the Hazier disease, where most of the children, those who go to the riverside, tend to have urine and blood in their urine. And so every year, government gets some grants through Ghana Health Service and Ghana Education Service. They go there and then give the school children 5 years to 14 years. They give them this praziquantel and an albendazole for treatment of hernia. But the disease every year it keeps going up, and there's nothing like any control for it. So when they were my students, so I used to take them to Asembosu to study this kind of disease at Asembosu, without knowing that the community just close to us also have this disease where it's very high prevalence. That is, if you check all the communities along the Kakum River, it's very high over there. And it seems like we have neglected them because, we don't know they are there. So, as a current study was done by a colleague, that find out that this disease is really very, very high in this campus metropolitan. So the brief background of the disease is caused by a worm called Schistosoma hematobium. And this is a worm, this is how the worm looks like. They are male and female. So once you go to the river, this worm enters through your skin. Once you come in contact with the river, the worm passes through your skin and go and stay in your veins. So the male and female will meet in your veins, and then they begin to lay eggs. So, the egg, the reason why a lot of people have blood in their urine is because the egg has some spines or pins around it. And so these pins makes wounds through your urinary tract. And so when you are urinating, because of the wounds that you have had, it comes with blood. And when they go back to the river, the egg will hatch, and the egg will enter, the worm in the egg will enter a snail. And within the snail, they will develop to a stage that can infect human beings. So those who go to the river, either you are going to the river to go and fetch the river to use as your house chores, or you are going there to swim the river, this worm can then enter into you and then go into your veins, where they stay there, meet, and then lay eggs. So in Ghana, it is believed, this is from Ghana Health Service statistics, they have made us know that in Ghana, 23% of the general population of Ghana had this kind of infection. Either we have had it before, or we are still having it, which is very high. If you look at our population is around 31 million. And then 23% of us have this kind of infection, and we are living with it. So, like I've mentioned already, every year we are targeting only the school children, leaving the adults. So we don't do anything for the adults who go to the river to go and fetch this water, and they have this infection. So, like I mentioned earlier, we had our friend did the work, and so we followed it up. We wanted to see whether it is really true. So we went to a sweatsheet. Then these guys were my students, so I took them there for practicals. We selected only few students to see whether really this infection is really there. And when we did that, we realized that among the few students that we selected, 31.6% of them have this infections. And this infection, what we were determining as infection are those that have active infection. Because you can have the worm, and the worm has not started laying eggs. So we are talking about only those that the worms have started laying their eggs, because we were determining eggs in their urine. And then we also went to the riverside. So these are some of the pictures that they took when we were here. And we went to the riverside also to check the snails, whether we can get these worms from the snails. And when we did that, we realized that this disease is there. So that is how we started that, okay, how can we control it? Because every year we give them the drug, but it doesn't seem like there's any going down of the infection. So that means that we have to bring in all the control mechanisms together to be able to control this kind of infection. So we brought this letter to the Metro to give us permission to go and do this. And so if you look at what I've said so far, basically people who are defecating or throwing waste across the river or going to the river to, swim in the river, deposit the eggs that they have into the river, and then this egg will hatch, and then they will infect the water snails. They will develop in the water snail, and when you go into the water, you get this infection, as I've already mentioned. So this is how the worm look like. And the most interesting thing is that if you have this worm and you are not treated it, you haven't treated it or you haven't killed it by drugs, you can stay with this worm for 40 years. So averagely in Ghana, our lifestyle is around 65 years. And imagine you have this infection for 40 years. So basically you are only free for 15 years if you don't treat it. So what are some of the symptoms that we hear? Basically, people come and complain that when he urinates, you can find blood in them. Or sometimes they feel like they want to go and urinate, but when they go, they can only pass on, only feel urine. And this is because you have wounds through your urinary tract. And so it's painful when you are urinating, so people find it very difficult to urinate. And also, normal general body symptoms when we are not well, like fever and other kind of symptoms, you also get some of them. So what we asked the Metro to give us permission to go and do was to go and find out if really this disease is very high in this community. And so what do? We go there, talk to the school children, we ask them few questions about whether they go to the river, whether they are using the river for house chores, or they just go there to swim. So we take that data and we give them containers to go and give us urine. And so you can see the different kind of, this is the normal urine when you pass on urine. But you can see this one are very bloody. Very, very bloody. And so you can see that kind of thing. And what we are looking for is that we are only looking for active infection that are productive. That is the worms that are producing the eggs. And so these are some of the eggs that we recover from the urine samples. So we spray down the urine and then we put the urine under a microscope to look for this kind of eggs. So this is a classical situation that we found in one of the schools that we were working in. This is a female class 3 student, and you can see all this thing you are seeing is the eggs of the worm. And you can see the background is very, very bloody. So you see the urine is very black. It's not like the normal urine we know. And this infection is very critical because when you have this kind of infection, your academic performance and even Ghana Health Service is very, very concerned, especially if you're a female and you have this infection and you sleep with anybody with sexually transmitted infection, you are easily to get this kind of infection. So what have we done so far? So we started one of the schools that we did the work was Akotoche. We have screened 260 school children, and 23 of them have very active production of this worm. That means they have eggs in their urine, and therefore when they urinate, they can find blood in it, which represents 8.8% of the school population have this kind of infection. If you look at a swatchery, that is where we started our preliminary studies. We have 382 students screened, and then 99 of them have eggs in their urine. And constitute about 25% of the students within these schools also having this kind of infection. And then we did also for Kapro. Kapro is a big school. They have A and B. So when we screened about 459, and 33 of them had this kind of infection, which represent about 7.2% of the school population. So in all, we have screened about 1,001 students, and 155 of them have active egg in their urine, representing the total, if you combine the three schools, about 14% of the school children have this kind of infection. And this is only those who are producing the eggs. So we have infections that are not yet producing the eggs. So we don't have, what we are presenting is not the total infecting scenario. These are those that are very active in terms of producing the eggs. And we wanted to check, because we wanted to know which group of children that are really going to the river to get this infection. And if we check, even KG2, we were expecting that KG2, which is maybe 4 years, 5 years, their parents will not allow them to go to the river, either to go and fetch or to go and swim. But we realized that if you take a switchery, the class is made up of 25 people, and 4 of them have this infection. I mean, producing active eggs. And then class 1, class 2 also have this infection, even up to 23.1%. From class 3 up to JSS3 in all the schools, you have this kind of infection. And you can even have up to 70% of the class having this kind of infection, and or in native class in their urine. So this is the situation we have. So why is Ghana High Service more interested in school children and not the adults? Because if you have this kind of disease, it affects our academic performance. And we know year in and year out, our public schools are underperforming compared to the private schools. Right? So what are some of these things that are happening within our public schools? Schistosomiasis can be one of the situations. Why are they having this lower academic performance? Because if you are sick and you go and sit down for people to teach you, I can bet on myself that even me, if I'm sick and a teacher or a lecturer comes and stand in front of me, I may not get anything. And so this is the scenario. And also there's growth retardation. I mean, because you are competing, the nutrient, when you eat the nutrient, you are competing with the worms. The worm eats from what you have eaten that's supposed to help you to develop. And also, basically, if you are sick, I mean, your school attendance will be on and off. So these are some of the literature that, I mean, is there for us to know that if you have the disease, your academic performance comes down compared to your colleagues that do not have this kind of infection. And also, when it comes to the females, because of how this infection is, it destroys your reproductive organs, because it's making wounds there. And once the wounds are there and you are not treated, I mean, it becomes something that, so you grow, and then either, if you're able to have child, sometimes because the place is destroyed, the child have to find itself somewhere, so leading to ectopic. And then majority of them too cannot give birth, because you are staying with this for about 40 years, and all your reproductive organs will now be very active function. And in terms of if you're able to give birth to, the child will be either you can get a preterm, low birth weight, and other things can also affect your child if you are likely to be able to give birth. And this egg can also find itself in other organs because it flows through your blood, through to your urine. So it can get into your kidney, can get into your liver, and then once it's there, it makes wounds there, and then you can have, sometimes even lead to cancers. So this is a classical case of a person that died, and they did autopsy. And this is, they have liver and kidney. So this is the kidney cells. The person died, and when we say autopsy, when you die, they just go and remove your organs, section it to see what really killed you. So one of the cases was this case where when they section the kidney, they realize that the eggs that are shown, you find the eggs stuck inside your kidney cells, and then it destroys your kidney, and your kidney cannot function as it's supposed to be able to function. And so the person died out of that. And then this is the autopsy report. So in the summary, this is what we have been doing. We take the urine samples, we go to the lab, fill the lab sessions, we screen them, and then what we do, we also come back, we select students, those that are positive. We want to compare those that are positive against those who are not negative in terms of the academic performance. And so we take the negative also. And then we take them to the clinics, because we are working also with the community clinics. We don't want to just be a researcher who go there and do everything by himself. So we take them to the community clinics, and then those that are infected, we give them the praziquantel treatment, and then those that are not infected, we don't give them anything, but then we take their blood samples and then their urine samples for analysis. So basically, what can we do? What we know for now is that if to prevent this one, we're supposed to have a mechanism to prevent people from going to the river, because we know the river is contaminated. And so the best way to prevent this is not to go to the river, or don't go and swim in it, or don't go and get in contact with the river. And then also, we also realize that if you look at Kakum, most of the communities dump their refuse dumps close to the river. And it's very difficult. Unfortunately, those who are close to the river also uses this river for their house chores. So it's a situation that stakeholders have to come together and discuss. So not only are we doing the research, but we are also going back to the community and discussing with the stakeholders. So this is one of the meetings that we had with Papro. It was a PTA meeting, and we were invited to come and talk about this kind of infection. And the people were participating. This was before we started this project. And now we have finished with the project. We have to go back to tell them what the evidence are. So, and they were very participating, and everybody was asking questions as to what they can do in terms of preventing this kind of infection. So we also went back, because for now it's the student that we have worked with. So we have to also let the children know what the situation is. And so these are some of we go back to educate the children that once we have given you the drug, please don't go back to the river and go and swim. But we know this is not going to work anyway, because there are people that is their livelihood depend on the river. They use the river to bath, they do everything. And so if you go there and tell the person that don't go to the river, it's more like you are just saying something in the air. So this one was also a professor where we also did similar for the schools. And not only that, because we want stakeholders. Those who make the laws and those who implement the law. So this interaction we had with the Metro Ghana Health Service, we had this interaction with them. We presented the issues to them, because they are working directly with the facilities, the health facilities over there. So now we have made them to know that this is the situation. What the immediate solution is just to provide the drugs for this health facility, so that in case anybody comes there to come and make a report, you can treat them. But that is just a temporary solution. We need a bigger interaction to be able to solve this problem. And this was also with Ghana Education Service, because you can't just go to any schools to go and work with the children without Ghana Education Service giving you approval. So we also seek approval from them, and so we went back to also tell them what the situation is and what they can, together with the PTA, can also come together to help us to be able to solve this problem. And this is a regional Ghana Health Service. We also have interaction with them, discussing about the same issue. And today we are also here to present the same things to you. And we know the authority lies in your hands to be able to help us in terms of so many things, in terms of the sewage system, in terms of the garbage control, in terms of even organizing the communities for us to be able to educate them on it. So we wanted you to know what the situation is, and then we will ask you to help us to organize, and then we can have something like stakeholders forum to bring our ideas how to be able to solve this infection, especially when this one is in the capital city, the regional city, which is close to us, very, very good. This is not a remote initially when you hear this kind of thing, you are thinking about a remote area, but this is with us. So the other thing that we also did was initial semester. We went to the schools, apart from the students that we were able to, treat them with the praziquantel. We also organized mass drug administration with Ghana Health Service to give everybody the drug, which is a one-time drug that the government always do, but it doesn't solve any problem. So these are some of the treatment that went on. So thank you very much.